Okay, so this is the entrance to Pisgah Recovery Services. Let's go inside and take a look. First of all, you come in here and you'll notice we have hand sanitizer and masks for everyone. So we provide those.
Per COVID.
Yeah, per COVID. So then we enter here. And so over here is our coffee station. We brew coffee in the mornings, make sure everybody's properly caffeinated.
Nice. Gotta have that
And
caffeine.
then this is our waiting area. That's the front desk. That's where our patients check in. And then over here, for people that have small children, they can come over here to this little play area and stay entertained while mom or dad is taking care of.
Excellent. That's great.
What they need to take care of. This is one of our counseling offices. And here's another counseling office. And one more counseling
Okay,
office.
excellent.
Yeah.
Okay, and plenty of privacy.
Plenty
I
of
notice,
privacy.
yes.
And then over here, this used to be a bank. So, our medication room is actually in the vault.
That is fabulous. Yeah, that was a nice building to take over.
You couldn't ask for a
That's
more
it.
secure place to store a controlled substance.
Yep.
We have a curtain that patients pull for privacy.
Okay. Do they actually go inside there then?
Huh?
Do they
No,
go?
actually, it's alarmed or I would,
Okay, no, don't do it then.
But actually, this opens.
Okay.
And then there's a window.
Okay.
Yeah, it's really a very neat setup. This
Yeah.
opens and there's a window and it's locked. The nurse is in there.
Okay.
And the patient will be standing out here.
Well, that's fabulous. Yeah, that's great.
Yeah.
Yes. Every patient takes a different dose, I'm assuming, a different milligram
Correct.
of
Yeah.
dosage.
It's titrated to whatever
Okay.
their individual level of need is.
And would I be right to assume they start a little higher milligrams and try to dwindle down, or
No, actually the opposite. We
Opposite,
start
okay.
low because we don't want to over medicate people.
Okay.
And then we
If
move
needed,
them up.
do you always move them up, or do you find that they can stay at that beginning milligrams sometimes?
No, we're typically it's very rare that we would give somebody their maintenance dose on the first day.
Okay.
So,
Okay.
doesn't happen very often.
Okay.
All right. Bathrooms down this hallway. And here is our medical office.
Okay.
Okay, so that's where our nurse and doctor would
Okay.
be.
And would they do some type of physical then, kind of,
Yes.
sort of ahead
Yes,
of
there's
time?
a-
Okay.
There's, for the purposes of admission, the patient meets with 3 different professionals.
Okay.
And they meet with the counselor for a counseling assessment, they meet with the nurse for nursing assessment, and then the doctor does their own
Okay.
interview and assessment as well.
And then from start to finish, that would take how long?
Approximately 2 hours.
Okay. Okay, that's great. That's pretty thorough.
Very thorough.
Mm-hmm.
And then, last and least, this is my office.
Okay.
So, I consider myself the least important person on this staff.
Yes.
The people that are really important are the ones who provide the direct care to our patients.
Yes.
So,
Yes.
I'm just the administrator. So, but I do have some nice vintage audio.
Yeah, I was
equipment.
going to say, look, you got a record player over there.
Oh yeah, I like my vinyl. So.
All right.
So
All right.
that's,
So that's the facility.
That's
Okay,
it.
there you go. How long, after the preliminary intake, if you will, would they kind of pretty much come in, take the dose, and then they're probably in here, what, all of 15 minutes? If
Less
you
than
will?
that,
No
less than
kidding.
that normally.
Yeah.
Unless they have a counseling session that day.
Right,
So.
right. So they're in and out pretty quick.
Yep.
And then, am I right, initially for the first good amount of time, they have to come every day? And,
6 days a week. We are closed on Sunday,
Okay.
so we provide them with medication to take home.
right. When do they get to the point where they can not come in every day?
So once they've gotten to the point where their dose is stable, and we've seen, a reduction, at least a reduction in their illicit use, then we'll start evaluating them for increased take-home privileges, and that used to be set in stone. That it was every 90 days. With COVID, they've kind of relaxed that, so
Okay.
it's really on a case-by-case basis at this point, for as long as COVID lasts, and then I
Right.
assume we'll go back to 90-day increments.
So you mentioned if they're diminishing their illicit use, do you find that there are, a number that continue to use then at the same time?
So, recovery is a process, and it's not like, they come here, and we start them in treatment, and, they immediately stop doing everything else. Sometimes it takes some time, and we have to, just try to work with them, to the best of our ability to motivate them to, make whatever changes they need to make,
Right.
to stop using illicit stuff.
Is that dangerous for them to be?
Well, it potentially, but that's why they come in every day,
Okay.
because we evaluate them.
Okay. Yes. Okay. Okay. All right. Anything else?
I don't think so.
All right. Well, thanks again. We appreciate the
Absolutely.
tour. Yes.